welcome the members of the media fraternity and, of course, my team from the Ministry of Health and Wellness. The person sitting to my, is this right? Right? Your left is the Permanent Secretary, Mr. Dunstan Brand, and, of course, the Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie. To my left, your right. All right, I want to just begin by thanking all of you for the ongoing support, if you will, exposure, if you prefer, to the issues around the challenges that we've been facing in public health, and in particular, the threat of the recently discovered, if you will, novel coronavirus, which we in Jamaica have been trying to manage, to prevent it getting into the country, and while at the same time preparing just in case that happens. There's a lot happening, as you know. Events are unfolding on a daily basis. It is new, hence the term novel, and as a consequence, things can and are changing on a rapid scale. We see our responsibility as public health to the public informed in the first instance, even while we do what is necessary to prepare ourselves for the prevention of having the virus here, and to protect, and at the same time the protection of our population, and at the same time ensuring that our health system are sufficiently resilient to deal with any possible introduction of the virus. There's always a margin of error in these things, and so you have to prepare for both. So I want to just place that in context. Now, as a result of the need we see for ongoing public education, public information, we have taken a decision that until we are comfortable based on what is happening globally in terms of the spread and the risks that the virus represents, we will try to be frequent in providing ongoing updates to the media and by extension to the country, because not only is it of interest, not only are you sort of securing information for your respective media houses, but it is a matter of public concern, and in a sense you're doing a public service too by providing that information, which we appreciate. So it may be a weekly update. If we think it can be every other week, then we'll do that. The situation is fluid. We'll watch it as we go along. So I'm going to read a statement that was prepared to provide the latest updates. And this statement, at the same time, I can't forget the threat of dengue and the flu season. So please indulge me to speak a little bit about those things also. All right, so the government of Jamaica remains vigilant in its efforts to protect the population from this novel coronavirus. Yesterday, or Monday, we had a discussion at Cabinet as part of the ongoing discussion, where we gave an update to the Cabinet and sought for permission to take some certain decisions. Coming out of that discussion, or that meeting, I am providing this more recent update. So the Cabinet has instructed, in the first instance, that a national coordinating mechanism be established, and the Ministry of Health and Wellness will be liaising with the various partners to see to its establishment. Normally when you have threats of this type, it is better to create a national coordination which involves multiple stakeholders, multiple ministries. More often than not, it is led by ADPEM, and that, of course, resides in the Prime Minister's portfolio. And so ADPEM would play a dominant role in pulling all the teams together. The Ministry, of course, will play an important role in providing technical health leadership. And so over the next few days, well, we have already started working on it, we will pull together this national coordinating mechanism. If you cast your minds back to 2014 during the Ebola scare, a similar such national coordinating team was established, and it would include not just government entities but also the private sector. And we think it is important, and Cabinet has agreed to that. Secondly, the restrictions on travel from China remains in effect. This means that in addition to the usual port health and immigration rules and procedures for air and sea craft for travelers who have visited China in the last 14 days, the following still applies. Only Jamaican nationals, permanent residents, and those with marriage exemption will be granted landing privileges. All travelers will be subject to immediate quarantine and for a minimum of 14 days. And travelers who show any symptoms of the novel coronavirus will be put in immediate isolation. So just to say that it is not that we won't accept persons coming from China, but there are elevated restrictions on those persons coming from China. Clearly, our nationals cannot be disallowed, if you will, from coming to their home, to their country. And so Jamaicans will always be accepted, but they would be restricted in terms of their movement once they come in to the quarantine period. And there are others who are linked to Jamaica. And I outlined, for example, persons who have marriage exemption. So you may have a Jamaican who is married to they may be coming with their families, but they'll be subjected to the quarantine period. So I know the term ban was used, and it may connote a very extreme position. Maybe one probably more appropriately should say heightened restrictions, to put it very clearly. Quarantine facilities are provided currently by the government. In some cases, isolation facilities are operational at public hospitals. So we do have at least up to now one main quarantine facility, and there are currently 13 persons in the quarantine facility and one person in isolation currently. And the difference between the two, of course, is that the quarantine facility really restricts the movement of these individuals who are quarantined, and the 14-day period would apply. Isolation speaks more to persons who display symptoms, flu-like symptoms, and are therefore placed in a hospital setting under hospital supervision to treat with those symptoms, but at the same time to validate or rule out any possibility of them having the virus. And that's the difference. One is a more medical context, the other is just to keep them from the general population. Each traveler from China will be assessed to determine the type of quarantine to be applied. This assessment will be done using a special risk assessment tool. Those determined to be high risk will be quarantined in a government facility. Those determined to be low risk will be quarantined at home, and those quarantined at home will be followed up daily by healthcare teams at the parish level. So there is the option of a quarantine arrangement at home, but it depends on the assessment of the risk. So depending on where that person is coming from, the willingness of that person to cooperate, the team will assess that risk, and they could actually quarantine that individual at home and their home surroundings also, whether they have the facilities. But that would be subject to follow-up by the medical team. Based on information currently available, this new coronavirus behaves in the same way as other coronaviruses, which means that the normal processing of goods coming into the country would have rendered them safe. And I guess CMO can give you the technical explanation around, goods and exposure out of the human body, that sort of thing, and therefore why it is safe to do so. The World Health Organization, however, is currently reviewing measures to deal with the global demand for medical masks. Jamaica does not currently have a stock out of such masks, and I want to make that clear that we do have a number of critical equipment in inventory, and we therefore will use those if we have to, and we will restock the supplies if necessary. Wearing of medical masks, by the way, I'm told by the medical folks, is not recommended except for those persons who will be in close contact to symptomatic individuals In fact, it may create a false sense of security that can lead to neglecting other essential measures such as proper hand hygiene. And again, I'll defer an explanation of that to the CMO when our time comes to speak. Given the risk, we are placing great emphasis on border protection and on the preparedness of frontline workers. To that end, we have engaged some 329 frontline employees at the Norman Manley International Airport and Sangster International Airport, including immigration, customs, port health, airport police, Jamaica Fire Brigade, aviation services, various airlines, and management staff at the ports. The training sessions have focused on the new coronavirus with respect to roles and responsibilities of the points of entries, as well as facilitation of prompt recognition of infection or potential infectious persons and implementation of an appropriate intervention. Key here is that we are engaging all the critical personnel at our ports. It's not just about healthcare workers, it's not just about nurses, it's all the persons who would have an opportunity or reason to interact or interface with persons coming on board, and that training it's something that's ongoing, but in a case like this where we have a new threat, then a special training arrangements will be put in place. Sensitize some 50 senior nursing managers and 50 physicians from the public health system across the island, sensitize 50 clinicians from the private sector, and sensitize representatives from the various professional health groups, including the Medical Association of Jamaica, the Association of Government Consultants, and the Jamaica Medical Doctors Association, together with professionals supplementary to medicine. So we are coordinating again with the entire medical fraternity, including the private sector, as well as these umbrella bodies that are going to be part and parcel of any major response that may be required. It is imperative that the Jamaicans, that really is the update on the coronavirus. Unless you have questions, I want to just say a few words on dengue, because 2 weeks ago everybody was on dengue, and then everybody has shifted now to corona, but the challenge of dengue remains and we're working on that also at the same time on a parallel track. So between January 1, 2018 and January 31st this year, there were 10,331 suspected, presumed, or confirmed dengue cases. Of that number, there were 1,069 with date of onset in 2018, and 9,159 in 2019, and 103 this year. So last year clearly was a very active year. Also, between January 1, 2018 and January 31st this year, there were 2,325 hospitalizations for suspected, presumed, or confirmed dengue cases, indicating the significant stress and strain that has been placed on our health system, particularly for inpatient care. Over the period, there were 85 suspected, presumed, or confirmed dengue-related deaths, 17 in 2018, 67 in 2019, and 1 so far this year, 2020. Also, over the period, 2,325 or 22.5% of the 10,331 cases were hospitalized for suspected or confirmed dengue. Of those hospitalized, 3.7% died, unfortunately, while 96.3% of course were discharged. Recently, we added 60 new motor vehicles valued at some $400 million to our fleet for the National Vector Control Program, 37 of them equipped with mounted foggers. And of course, we had our national dengue cleanup. And so far, we are pleased with the response to this additional effort and infrastructure that we have placed in the National Vector Program. We have actually renewed the entire fleet of the Vector Program. These vehicles would be serving every single parish, and the mounted foggers that are significantly more efficient than the handheld ones. They cover a lot more communities, a lot safer to operate in terms of the workers. They are new vehicles, so we should have no downtime. So we expect that certainly as it relates to addressing the mature mosquito threat, because that's what the fogging does. It kills the mature mosquitoes flying around. The country is well equipped to address in a more efficient way that particular threat, and we hope to see the results of that over time. It's not the only strategy, but it's an important part of the program. The national cleanup, which was a multi-agency, multi-ministry effort involving local government as well as Minister Grange's ministry, culture, gender, and a number of other things, and ourselves, but led by the Labor Day Secretariat, which Minister Grange has responsibility for, went very well, we thought. We saw a number of participants at the political level, at the community-based organizational level. The Honorable Prime Minister was involved, of course, and there was a significant cleanup across the country. Solid waste in particular, sensitization because of the house-to-house walks, and I think the country will be better for it. I would like to use the opportunity to appeal to our Jamaican people to recognize that solid waste and the presence of solid waste is an ongoing, it's a moving target, put it that way. If you don't get rid of it properly, it will pile up again. And that still represents one of the biggest threats in terms of mosquito breeding sites. So we had a cleanup weekend, but we would like to see it become is a culture and a behavioral change towards ongoing management of solid waste. And we hope that message would have gotten through. So we are hoping that the additional methods, the consistency of methods, the engaging of the community will see us having better results on the dengue challenge, but we're not going to be complacent, and we're not going to call or conclude on the threat until we're very comfortable that we have it under control, and we will keep you informed in the weeks and the months ahead as the numbers come in and as we adjust the strategy to meet the particular challenge that is facing us. A little bit on influenza finally. So that's the flu season. We want to remind the public that in the 2019-2020 flu season, it's on, and that the flu really can affect every and anybody in any age group. However, children, persons with chronic illnesses, pregnant women, and the elderly are at high risk for complications from the flu, and these complications include pneumonia and blood infections. We urge Jamaicans to get their flu vaccine while also practicing good hygiene, including washing hands with soap and water, covering the mouth and nose while coughing or sneezing. Of note is that these good hygiene practices are also important for the prevention and spread of the novel coronavirus should we face that threat directly here in Jamaica. So it's just good practices all over. And, given the flu season, we keep reminding ourselves of it. I want to just urge the country to recognize that. All right, thank you very much. The floor is open for questions. Yes.
Good morning, Minister. Ashley Saunders from Jamaica Level. You mentioned getting information out there through the media, but is there going to be a targeted education campaign to address things like stigma, for example? We've had complaints to our newsroom of Chinese nationals, Jamaicans and Chinese nationals for experiences. What's their approach to that?
All right, so there is actually a campaign taking place now. If you saw the print media, for example, I don't know if today, but certainly Sunday, you'd have seen full-page ads about the coronavirus, I'm assuming, right? You're asking. If you follow social media, you would have seen a number of daily postings, both from my page, but also from the Ministry of Health and even from the regional health authorities. We would have done a series of interviews. Myself, the various medical team members, I try to keep up with you guys in the media. I get a call almost every day for a comment, and I try to respond because I know it's important. And that's part of the public education method. I understand that we will hear some radio ads coming out soon. So yes, we are engaged as part of the response in a public education program. I suspect, though, given the second part of your question, you may be concerned more about the content of that public education, given the stigma issue that you have raised. And I think it's important that we include that in the narrative. I have personally tried to. I've made it very clear, and I want to make it clear again, that our efforts to minimize the threat or the risk of the coronavirus is in no way, shape, or form a commentary or a reflection on the strength of the friendship and indeed the Chinese race and the people of China and China as a country. We are working as in the interest of our nationals, our people, yes, to protect our country from this virus, as other countries are doing around the world. But as far as we're concerned, we are doing so in the interest of humanity, including the Chinese population, who themselves are doing a lot in their country, which includes a number of the measures that we are taking here, restricting travel, quarantining, isolation, all the things that we are doing are being done there. And we certainly share the concerns that they share, and we are, as best as possible, coordinating with them to ensure that we solve this problem together. So it should not in any way, in any of our actions, be interpreted as being discriminatory, because that's certainly not the intention, and we'd encourage Jamaicans not to take that approach either. On Sunday, I attended the 2020 Chinese New Year celebration garden party at the Chinese Benevolent Association, where I spoke, and that was my message also. Annual event attended primarily by members of that nationality, and it was important, I think, to send that signal that the Chinese people are our friends, and we continue to enjoy very good relationship. We are sorry about what is taking place there, and we share with them in whatever way we can to ensure that we work together to address this issue. Any other? Yes.
So the ban has been lifted?
No. No, it's not a matter of lifting. I'm just saying that the ban, the term ban should not be interpreted as no one coming from China being allowed to land. Because under law, for example, we can't refuse landing status of Jamaicans, many of whom, by the way, who are in quarantine now are Jamaican nationals. I think all of them, the 13. And you can't refuse them entry into their country. So if you interpret ban in the strictest way, meaning no one at all, then it probably would be a wrong choice of a word. But there is heightened restrictions in that we are not encouraging persons to travel to China or to travel from, and if they do, they are going to be subjected to the quarantine arrangement or isolation. And that's very important to continue to send that very strong message. Oh, well, the PS is telling me also that those restrictions also include refusing landing status of persons who do not meet the criteria that I have just spoken to. So we have in fact turned back a number of persons on the next flight, basically, without allowing them landing status. I don't know what the numbers are now, but it's quite a few.
27.
27? About 27 persons have been turned back.
So the 13 persons you have quarantined now, they're at the airport? Or
No. They're at a facility. I prefer not to say.
All of them are in one particular...
They're in their own space, but in one central facility, yes.
And isolated case?
The isolated case is in a hospital, in an isolation room. And as I said before, a number of persons have been refused landing status and have been actually placed back on the next flight to their place of origin.
Just to know that the person who is in isolation is not a suspected
Yeah.
case, but it's just because of a precaution.
Right, right. I think we had reported that already, that the person who is in isolation is not presumed to be a suspected case of coronavirus. So I don't want that to be the headline that we have one. Let me not say it, just in
Sorry,
case.
can you give us an update on the UA situation? And
Oh no, that has been, that situation has passed, and it's all back to normal.
and the case that are not to be.
Right, that's the one. So that's the person who was placed in isolation, and even though they do not meet the case definition based on the WHO prescription, if you will, we have still, out of an abundance of caution, placed that person in isolation for observation and treatment. So that person that's the one that's in isolation now.
So why is that person not to be a non-chest hospital that is?
They're not to be actually. We had relocated them, right?
Well, it's been circulating on social media that the person is at not to be.
Yeah.
Some kinds
Yeah,
of
at
order
another
or something.
They are at another facility, and this is another good example of why not everything you see on social media you should believe. And I know you know that, but yeah, they are not at another bay anymore. That's where they started, but we have moved them to a secure location.
It's a function of the risk livelihood and moved them to this hospital.
Yeah. If we felt that the person had, if we felt more concerned, put it that way, about the status of this individual, then we would have probably relocated them to the chest hospital. So we're not as concerned. Chest hospital, as you know, is a facility that's focused primarily on respiratory, and I would think they have probably the best isolation facilities.
Yes, sir. Good morning to you.
Good morning.
My name is Shadeen. I'm living from TBC Radio. And my question is, currently we're treating with dengue. We're also treating with flu and a potential coronavirus at the same time, simultaneously. And my question to you is, how is the Ministry of Health helping to prepare the medical professionals to handle the impact that the strain can have on the human resource capacity and as well as their emotions? Because I know I've heard persons in that fraternity complain about the stress that comes with having to deal with
I thought you would start that question by asking me, how am I dealing with the stress? And I would have responded by saying, taking a lot of vitamin C in the mornings. No, it's a stressful time for all of us. The team that you see here, and you know, I'm proud to say I work with a lot more women than men, and they handle stress a lot better than the men, right, Piers? It is challenging. This ministry has, health is always a challenging portfolio, and particularly in a population that has particular vulnerabilities, whether because of climatic changes or because of overexposure. In our case, we are a very open society, and as a consequence, for one reason or the other, natural disasters or otherwise, we are vulnerable on an ongoing basis. So I say that to say that while the environment is stressful, the reality is that we are very experienced in dealing with stress because there's another crisis around every corner almost. I've been in this work for 4 years, and it has been one challenge after the other. Can you imagine the people who have been in it for 20 and 30 years? But having said all of that, we do provide critical support where it is needed. The system does make provisions for counseling where counseling is required. The fact that it's a fraternity of medically trained personnel, clinicians, there is the possibility of colleagues supporting colleagues when those things occur. If necessary, persons can be diagnosed and given the appropriate support within the very system that they work and exist. So the system allows for that kind of inbuilt structure, but it's not to say the stress isn't always there, because right now it is very challenging. And you know, it's a good question, because I use the opportunity to appeal to the public to appreciate that the challenges that they face, as important as it is, and it is our duty to respond to those challenges, can sometimes be equated to the challenges and the stress that those who are providing the service face, because it can become overwhelming at times. But we try to make it work. I don't know if you want to comment anything any further on that.
Well, right. I would just want to say in response to that, that as a ministry, we do recognize that there's a significant burden on our healthcare providers. I mean, we saw that coming out of the response to the dengue outbreak, and we know that at this time we were geared up for influenza, and now we have a triple threat that we're facing. So as Minister says, we understand that members of the public are challenged, but we also just want them to bear in mind that the healthcare providers are under significant stress. Coming out of dengue, we had put measures in place, asked hospitals to look at how we support mental health of our staff, and we will be revisiting that to ensure that our staff get the necessary support that they need.
Okay, any other? Yes. Hi. Students. Okay, no, none of the 13 in quarantine now are students. And in terms of the students, and an update on the students, the Ministry of Foreign Affairs and Foreign Trade, Minister Kamina Johnson-Smith, I know is actively engaged through the mission located in Beijing, in communicating with them and ensuring that their interests are represented. And she can comment more authoritatively on any specifics related to that. But I know that the government continues to dialogue and keep in touch with the students.
In terms of medical support, in the case where they may need some supply.
In all areas.
So she's the one leading that charge.
Exactly. Okay, it's more a foreign affairs issue.
Understood.
Mm.
As it relates to the flu aspect of things, I noticed that one of the little lines here that seems to bear a lot says these complications coming out of flu could result in pneumonia and blood infections. And I recently took a trip to the Bustamante Hospital because my son ended up with blood infection, and I could not figure out what was the connection between the flu and the blood infection.
All right. Well,
What do parents look for? How quickly can transition from a flu to blood infection? Is there some sign that it's longer just a few weeks transition to something mega? What do I do now? That sort of thing.
all right, I'll ask the real doctor to comment.
Well, the majority of flu cases are going to be mild, okay, and can be treated at home. Most persons will have upper respiratory symptoms, cough, sneezing, runny nose, fever. However, we don't expect that the symptoms are going to last for more than, say, about a week. If it is that and after the illness starts, we expect after a few days that you're going to be getting better. If you find that you are not getting better, the fever is persisting, and you are just generally unwell. For children who are unwell, the symptoms are usually very clear. They stop playing, they stop eating, okay? Don't just think that they want to sleep, okay? If that is not normal for them, then you must seek medical advice. Persons must be sensitive to the fact that there are no specific symptoms that are related to the flu or even to dengue. General feeling of persistent unwellness, just persistent symptoms, you must seek medical advice. That's the only way we are going to catch it early. And seeking medical advice don't necessarily mean that you need to go to the hospital. You can visit your primary care provider, and especially if that primary care provider is tracking the patient, then they can compare. Okay, but it's really the parent's history that is most important. When the parent says that this child does not look good, this is not the usual child, this child is just different, something is wrong, then we need to be sensitive to that.
Okay.
Okay.
Any other question? No? All right, so thank you very much again for being here. You can ask any member of the team any additional questions you need, and we will keep you informed as time progresses on this issue, and we appreciate your transmitting the information to the public. Thank you. I'm gonna go.
Mr. Morning, can I ask you more questions?
You're from Ira FM?
Yes, sir.
Oh, Lord.
Why you say it like that?
What's up now? Thank you, CMO.
Okay.